Tonight, the permanent secretary in the Ministry of Health breaks the deafening silence on reports that a woman had the wrong leg amputated at the Owen King EU Hospital. The chief medical officer warns that the island could erode gains made to flatten the COVID-19 curve if illegal mass crowd activities continue to be hosted. And the St. Lucia Hospitality and Tourism Association questions the wisdom of reopening the cruise tourism sector. The details of these stories and more are coming up.
This is the Hot 7 Nightly News with Lovelyz and Amy Joseph.
Good night. It is Thursday, the 25th of March, 2021. Welcome to the Hot 7 TV Nightly News. I'm Lovely St. Amy Joseph. Thank you for joining us. Some light is finally being shed on the situation surrounding the wrongful amputation of the leg of an elderly woman at the Owen King EU Hospital. The matter was raised after a woman posted a complaint on social media claiming that her grandmother had been hospitalized to have one leg operated on. However, after the surgery, doctors realized that the wrong leg had been amputated. Attempts have been made since this news broke to get a statement from the hospital as well as from the Ministry of Health. However, all attempts were in vain. That was until the permanent secretary in the Ministry of Health, Benson Emil, spoke on the matter Thursday morning.
The situation that has been brought to the attention of the Ministry of Health and Wellness. And, as is normal, there's a process, for, reviewing such matters, and that is currently ongoing. So as we speak, the management of the hospital, they are undertaking, the necessary process. They're going through the necessary process, gathering, all the relevant reports that would inform, what transpired. And thereafter, the discussions around with the family and with the legal representatives of the government, that will ensue.
The permanent secretary gave his assurance that the Owen King EU Hospital is a trusted medical institution and that such occurrences are extremely rare. But with that said, the question was asked, is this an admission on the part of the ministry that the wrong amputation indeed occurred?
We trust, the clinical people at the hospital. We trust, the management at the hospital to deliver, proper care, to the population. So the hospital is still, a relatively safe place, to administer, healthcare services, to the entire population. It is reported that, this transpired until, we have gathered, all of the reports and figured out, exactly what transpired. I will not be in a position to confirm.
That was the permanent secretary in the Ministry of Health, Benson Emil. Now, the government of St. Lucia is expressing concern about the decision regarding World Cup qualifiers. That decision led to protest action by members of the St. Lucia Football Association on Wednesday. Let's now go to the government's senior communications officer, Nicole McDonald.
The government of St. Lucia is disappointed by reports that St. Lucia has withdrawn from the FIFA World Cup qualifiers, a decision taken without any consultation with the Ministry of Youth Development and Sports by the St. Lucia Football Association. The St. Lucia Football Association is an independent organization that governs football within St. Lucia. The government of St. Lucia, through its sports infrastructure program, made it a priority to upgrade the Soufrière Mini Stadium to host World Cup qualifiers. And the government of St. Lucia is clear and unambiguous in our commitment to upgrade facilities for this particular objective. The government of St. Lucia is further concerned about reports that the authorities turned down requests for special training permissions for a national football team. The government can confirm that we have no record of a request being made by the St. Lucia Football Association to have a team train for World Cup qualifiers. Neither the Ministry of Youth Development and Sports nor the Office of the Chief Medical Officer has received such a request. Despite the fact that high-contact sports are not allowed under the current COVID-19 protocols due to the high risk, the government has made special provisions for national athletes that is reflected in the legislation. The government of St. Lucia, through the Ministry of Health, recently facilitated training for Platinum FC from Vieux-Fort South, who are due to travel in April for a tournament in Curaçao. The government will also be assisting with the vaccination of these footballers and team members. The Ministry of Health has facilitated some netballers and other athletes who requested one-on-one training or training with strict protocols. Hopefully, the Football Association will engage with the Ministry of Youth Development and Sports and local footballers to resolve this matter. We look forward to the full clarification from the St. Lucia Football Association as to the reasons for St. Lucia's withdrawal. The government of St. Lucia has made significant investment in sports in St. Lucia, including football, with the establishment of the Sports Academy and the upgrading of all our sporting facilities in order to attract regional and international tournaments. The government will continue to do all we can to facilitate the advancement of our athletes and St. Lucia as a leader in sports. The government sees the participation in activities such as World Cup qualifiers as critical to the development of sports and has done all within our power to facilitate the involvement of our athletes.
In other news, the Chief Medical Officer in the Ministry of Health and Wellness is warning members of the public that premature social activity will lead to an upsurge in COVID-19 cases, given how quickly the virus spreads. Dr. Belmar George stresses that mass crowd gatherings are still strictly prohibited as St. Lucia continues efforts to reduce COVID-19 infection rates. Of late, the number of COVID-19 cases being recorded on the island has decreased significantly. The island's Chief Medical Officer, Dr. Sharon Belmar George, says St. Lucia risks eroding the gains made in flattening the curve of this third wave of COVID-19 if people continue to flout protocols that limit the number of people allowed at social gatherings. The CMO says the reports of fetes and parties involving large crowds of people are very concerning.
At this point, we remind the public that although we note the flattening of this third wave, we still have over 100 active cases. We would like to alert the public that mass crowd activities and open socialization is not recommended nor approved at this time in our management of the pandemic. We continue to receive numerous reports of widespread socialization across the island. We are still at high risk at this point in time.
The public health team is working to reduce the number of active cases to less than 50 to enable safe opening up of activities. The Chief Medical Officer asked the public to work with the Ministry of Health and to continue to be patient. St. Lucia has recorded a total of 4,161 COVID-19 cases to date, with a total of 58 COVID-19 related deaths. At present, there have been a total of 3,977 COVID-19 recoveries. Dr. Belmar George says the ministry is encouraged by the progress made in managing the current wave of the virus.
During the month of March, we note the steady decline in the number of cases, in the number of persons accessing care at the respiratory clinics, and the reduction in the number of admissions at the respiratory hospital. We applaud the public for their cooperation during the last few difficult months of managing this third and intense wave in country. We understand and acknowledge the level of frustration that the public has had to endure by the many protocols and lockdowns in the past year. These measures have been implemented in an effort to reduce the impact of the virus on our vulnerable population. As we reduce the cases and the risk, we have been reducing the strict measures in a controlled manner.
With the rollout of the COVID-19 vaccine, the Ministry of Health says it is hopeful for quality of life improvements in relation to COVID-19 in the near future. Players in the tourism industry remain cautiously optimistic about the resumption of cruise tourism for St. Lucia. The Chief Executive Officer of the St. Lucia Hospitality and Tourism Association says that while it is good news to have the sectors reopening, one cannot help but question whether it's the wisest decision to make. Nisha Charles reports.
Since March 2020, the tourism industry has been looking towards a reopening with varying degrees of optimism. When industry players thought that the summer of 2020 would have seen some sort of reopening, they realized that it was only a dream. 1 year on, the CEO of the St. Lucia Hotel and Tourism Association, Noorani Aziz, says their level of optimism is tempered as it relates to the resumption of cruise.
We are very excited about the possibility of the commencement of cruise to the destination. And we understand that within the COVID context, the modus operandi is going to change, okay? And now with the cruise lines making it mandatory that passengers are going to have be vaccinated, we understand that they're going to insist that team members as well be vaccinated. We're not sure what demands are going to be placed on our destination in order to position us to receive these visitors, because we are noting that in other destinations, hospitality workers are required now to, in some instances, to be vaccinated. And within our context, in our environment, it is still non-obligatory.
The St. Lucia Tourism Authority recently announced that the cruise sector would resume this coming July with the most stringent safety protocols. Aziz says the sector is relying on the medical practitioners to guide this reopening.
It's very clear that we have been taking our leads from the medical practitioners at every step of the way. The records are very clear that the industry has been clawing tooth and nail over the past few months, in many instances begging for consideration for reopening of some sectors where we have noted that we have not seen evidence of transmission of the disease, but the authorities, with all due respect, being cautiously extra cautious, have preferred to stall the opening of those sectors until we saw a national reduction in the COVID cases. And that is well appreciated and that is well respected. We continue to take our guidance from the medical practitioners, noting the reality of the variants in the global market. I am not sure, as a small island developing state, as an economy that is against the ropes right now, and given what is happening in the international market, I am not sure how much longer we can continue to operate at bare minimum.
St. Lucia expects its first cruise call for the season, Celebrity Millennium, mid-July. For the Hot 7 News, Nisha Charles reporting.
Meanwhile, the Permanent Secretary in the Ministry of Health, Benson Emil, could not give a definitive response as to whether plans to reopen the cruise sector are well thought out.
There is time between now and July, and I trust, that all of the necessary, research that has to go into making that decision, that it is going to be made. And at the end of the day, whatever the outcome is, it would be one that is well informed, and serving, the best interests of St. Lucians and the health and well-being of St. Lucians.
That was the Permanent Secretary in the Ministry of Health, Benson Emil. Stay with us. Still to come, the Gros-Islet Minibus Owners Association to pump the brakes on operations to observe silence for slain member Hermia Lord. Mayor Peter St. Francis has breaking news on his political ambitions and future, and outrage over animal cruelty caught on camera.